What is germline testing for breast cancer? Imagine uncovering the hidden genetic clues that could tell you your risk for breast cancer before any symptoms appear. That's what germline testing is all about. It's a special kind of genetic test that looks at inherited gene changes, called mutations or variants, which are present in every cell of your body. These changes are passed down from parents to children, meaning they are part of your genetic blueprint. Germline testing focuses on specific genes known to influence breast cancer risk, especially genes like BRCA1, BRCA2, and POLB2. Mutations in these genes can significantly increase the chance of developing breast cancer and other related cancers. For example, women with BRCA mutations are more likely to develop breast and ovarian cancers at a younger age. This testing helps identify whether you carry these inherited mutations, giving you a clearer picture of your personal risk. This type of testing is particularly useful for assessing hereditary cancer syndromes, such as hereditary breast and ovarian cancer syndrome. People with this syndrome often have early-onset breast cancer, cancer in both breasts, or a family history of ovarian, fallopian tube, or peritoneal cancers. Sometimes, other cancers like prostate, pancreatic, or melanoma may also be more common in families with these mutations. The main goals of germline testing are to evaluate your inherited risk, guide screening and prevention strategies, and inform treatment options if you are diagnosed with breast cancer. For instance, if you find out you have a BRCA mutation, you might choose more frequent mammograms or MRI scans starting at an earlier age. Some may consider risk-reducing surgeries like removing healthy breasts or ovaries to lower their chances of developing cancer. For those already diagnosed, knowing about inherited mutations can help doctors decide on targeted therapies, such as PARP inhibitors, which are more effective in patients with BRCA mutations. Germline testing is usually done with a simple blood or saliva sample, making it a straightforward process. It's different from tumor testing, which looks at genetic changes only in the cancer cells. Instead, germline testing examines inherited gene variants present in all your cells, giving a broader view of your genetic risk. Current guidelines recommend offering germline testing to anyone diagnosed with breast cancer before age 65, especially if there's a family history of cancer or specific clinical features like multiple primary breast cancers or male breast cancer. The testing panels often include several genes beyond BRCA1 and BRCA to cover a wider range of inherited risks. Before you decide to undergo germline testing, genetic counseling is highly recommended. A counselor can explain what the test involves, what the results might mean, and how they could impact your health and your family. They help you understand the benefits, limitations, and possible psychological or insurance implications of testing. In summary, germline testing for breast cancer is a powerful tool that helps identify inherited genetic mutations linked to increased cancer risk. It allows for personalized strategies to prevent, detect early, or treat breast cancer more effectively. Plus, it provides valuable information for your family members, helping them understand their own risks. Remember, always consult healthcare professionals to interpret your results and develop a plan tailored to your unique genetic makeup.